So for our medical moment today, one of our Facebook fans requested the topic. So we're going to talk about fatty tumors in old dogs. So here's the deal. It is very common for dogs to develop fatty tumors as they get older. And generally we can describe a fatty tumor as being below the skin, above the muscle, well encapsulated, and when you feel it, it's squishy like fat. And fatty tumors, pretty reliably, that's how you can describe them. The dogs who form fatty tumors, they tend to form a lot of them. So when we see one, it's not unusual for us to see 2 or 3 or 10 on the same dog. Most fatty tumors appear, they grow to a certain size and then they stop and they don't change. And as a rule, they're benign and they don't cause any problems. The concern with fatty tumors is twofold. One is sometimes they don't stop growing, they keep growing and getting bigger and bigger. And depending on their location, sometimes that's no big deal, or sometimes that becomes a big problem. For example, if a fatty tumor is behind the arm and it gets so big that they have to swing their arm funny to walk, then that's interfering with their stride and that's trouble. So there are times that even though we know that a fatty tumor is benign, we choose to take it off because it's causing trouble, or it might cause trouble in the future because of its location. The second concern with fatty tumors is when we think a mass is a fatty tumor, but it really isn't. So my big concern about fatty tumors is not the tumor itself, it's that a client or we might be fooled into thinking that a tumor is just a fatty tumor, when in fact it's not. And so while it's true that it's common that we can describe them as I did, the concern is what if we're wrong? Well, so here's what you do. We don't simply rely on the feel or the shape of the tumor, we actually do needle aspirates. And that's how we can go beyond guessing to actually knowing if a tumor is benign. The tumors we're most concerned about are ones that don't fit that description. So instead of being below the skin, if they are of the skin, meaning when you move the lump, the skin is moving, then that's usually not a fatty tumor. Or if it is within the muscle. A fatty tumor, typically, not only can you move the skin over the top of it, but when you grab the mass, you can move the mass relative to the muscle. If a mass is deeper, then I'm more concerned if it's attached. If a lump is lumpy like cauliflower, instead of being smooth and encapsulated, if it's firm, then all of those are red flags that is probably not a fatty tumor. Of course, then just to make it complicated, some fatty tumors are attached, some are lumpy. So bottom line is we do needle aspirates and we chart in the medical record when we saw them, how big they were, so that over time we can see, are they changing, are they growing. Any other questions about fatty tumors or lumps? Okay, great.